going to see the fracture of the scaphoid bone. Here the patient would have tenderness on the snuff box, so it is exactly here. See the snuff box here, exactly here. If there is tenderness, we should suspect this scaphoid fracture. The scaphoid bone fracture is the most common fracture of the carpal bones. It is the result of falling onto an outstretched hand, like this. The best initial test would be an X-ray, but it could take like 2 weeks in order for us to be able to see the fracture. And when we suspect this, we will do certainly the test if there is tenderness. If there is tenderness, we need to treat it, even though we are not sure. And the treatment is just a spica cast for the thumb and following up. So if the X-ray was negative, but we suspected it because of tenderness, we will put in the spica for 10 to 14 days, and then a repeat X-ray, and we certainly should see it. If the patient has persistent symptoms after the 14 days of this conservative treatment, we should do a CT scan. Now, immediately, the X-ray can take 2 weeks to be able to report the fracture, but the CT scan and the MRI can do it immediately, but they are not the initial test that we do. We do X-ray. If it is negative and we suspect it, then we treat it, and the CT scan will only do it if the patient has persistent symptoms after the 14 days of treatment. If there is a proximal third fracture of the scaphoid bone, the patient may develop a vascular necrosis because of the disruption of the blood supply, and in some cases we need to do open reduction. This would be, for example, if there is a non-junction with no displacement of the fracture.